Awesome. Thank you for your patience. Okay. As I mentioned, today is the launch of our stem cell transplant community chapter. We created this chapter, in the very beginning, Jenny and I were talking about, what chapters are important for our myeloma crowd community program to have. And we came up with things like the newly diagnosed chapter, the nutrition and wellness chapter, the fitness for myeloma chapter, the African American chapter, things that were obvious needs or obvious interests that our myeloma community had. And we debated having this stem cell transplant chapter because we just didn't know if it would gain enough momentum or if it was important enough. And we had a meeting. Barb Hansen gave a wonderful presentation in our newly diagnosed chapter about stem cell transplants. And there was so much excitement and buzz around that event. And simultaneously, several of our myeloma coaches came together and said, we're going to create resources, practical resources for the next generation of myeloma patients because there's not enough out there. And so with all of this buzz going around, Jenny came to me and said, we're definitely doing a stem cell transplant chapter. So I'm so excited to launch this chapter with you today. I'm so thankful to Amy, to Dawn, to Mary for their hard work. They're going to be talking about inpatient and outpatient stem cell transplant procedures, as well as what it looks like to really recover. This meeting, just so you know, is 90 minutes long. We're going to have adequate time for question and answers at the end of this presentation. If you can't stay through the whole thing, that's completely okay. Remember, it is going to be recorded and all registrants are going to receive that recording. So let me introduce our featured speakers and then we'll get started. Amy Gebhardt currently lives in Nashville for the winter, summering in upstate New York and on the St. Lawrence River with her husband of 24 years, Paul. Her career is very diversified and she has always enjoyed a new challenge. At age 54, she moved to Nashville with her husband and was diagnosed with multiple myeloma 6 months later. She underwent 6 months of induction therapy and in February 2019 had an autologous stem cell transplant. She achieved a stringent complete remission following the SCT and has remained on maintenance therapy since May of 2019. Dawn Bathurst, I hope I said that right? Okay, good. I was like, wait, was diagnosed on January 8th, 2018. After 6 rounds of VRD and an autologous stem cell transplant in August of 2018, he achieved complete remission and stringent complete remission since November 2018. Since his retirement, he has focused his attention on his own health and ways that he can help others on their journey with this disease, serving as a coach with the myeloma crowd. He also keeps his hand in professional activities, such as a fellow of the National Academy of Public Administration, serving on the editorial board of the Society of Fire Protection Engineers, where he is a fellow, and vice president of finance for the National Fire Heritage Center. Mary Sage lives with her husband, son, and 2 dogs in the Pacific Northwest region. She was diagnosed with stage 2 IgG lambda in November 2015 and placed on immediate disability due to severe pain and limited mobility. Like many others prior to diagnosis, she experienced bizarre blood results and chronic back pain that was becoming debilitating. Currently, her blood work shows activity, but too low to quantify, and her treatment is Darzalex Faspro. With that being said, Amy is going to go first and talk about outpatient prep and procedure, followed by Don, who will give his experience with inpatient SCT, and Mary will follow and talk about post-SCT recovery. Amy, the time is now yours.
Thank you. And thank you everybody for coming to learn about this. So each facility is a little bit different. Audrey, I'm not seeing the slides.
I know, I actually.
Okay. That's okay. I didn't want to start on them and get going.
No, it's
but
okay.
I know, yeah. Initially, I just wanted to tell you a little bit more about my situation. So I was diagnosed with stage 3 Kappa light chain in August of 2018, and I had actually broken my back and my sternum when I was trying to get out of a kayak after going on about an hour-long paddle. I also had 90% plasma cells in my marrow, so a very high level of cancer in my bone by the time they were able to do the diagnosis. I'm considered high risk because I have several genetic mutations in my DNA, and that was conveyed to me during my FISH test shortly after diagnosis. I started on VRD, which many myeloma patients do, and I was working with a general oncologist initially. I then transferred to a specialist because we were expecting after 4 induction therapies that I would go through a stem cell transplant, but my cancer levels were still too high. I was at 70%. My specialist then changed my treatment to KRD, and I went through 2 months of that. Since my stem cell transplant was postponed, I decided that it was time to have back surgery because it really was better to have it done prior to the stem cell transplant than having to wait for 6 months after the stem cell transplant. So I did have kyphoplasty to help those 3 crushed vertebrae in the back. And I am certainly glad that I did it because I have much better mobility today than I did at the time. I was in a back brace and had very strong limitations on anything that I could do. I went through a month of physical therapy between my back surgery and my stem cell transplant just to help get me stronger again before I went into my stem cell transplant. And I conducted that at Sarah Cannon in Nashville in 2019, February. So why go through a stem cell transplant? I know when I first talked to my doctor about it and found out about it, it seemed a little scary. And I tried to talk him into letting me not have one. But he assured me that it was really the goal, and what they find they've been able to do is get people into remission faster, and that they're able to keep them there longer, and that they've had 10 years or more of experience with stem cell transplants. And that's why most specialists feel so strongly about it. And most patients that go through this will go through somewhere between 2 to 6 months of induction therapy, trying to reduce their cancer below 20 and getting it as close to 0 as possible. So it is slightly different for each person. At the beginning of the process, maybe about a month before my stem cell transplant, I met with the transplant coordinator, and she provided a calendar outlining the process. What are the days that I was going to need to be in the clinic? What were all the different steps that were going to need to happen leading up to the transplant? And then information that I would need for recovery. I met with the care team at my hospital, and that included a financial coordinator, which really took care of everything that I needed on the insurance standpoint and the payment standpoint. I met with a dietitian that would help provide guidance in terms of what's the appropriate neutropenic diet to be on post-transplant. Met with a social worker. They were really concerned to make sure that we had enough support, family or friends that would help with the caregiving while I was at home. The pharmacist to discuss the medications that I was going to be on that would help boost my immunity when it was so low and keep me protected. And then also nurse practitioners, again, just to help follow up on the process. I attended, along with my husband, a training class that was about 5 hours long. And they thoroughly went through the entire process that we were going to witness and I was going to go through. And it also showed my husband how to care for my trifusion port. So he had to flush and clean that daily. And so they showed him exactly how to do that. And then because they really want to make sure there's a commitment of a 24/7 caregiver for you prior to doing the process, my husband actually had to sign a caregiver agreement, which was just a 1-page agreement, but it outlined the expectations for the caregiver, and they had to make that commitment that they were going to do that. So prior to going into the hospital, there were a few things that we could do at home because you really want to make sure that your home is as clean, dust-free, mold-free, bacteria-free, virus-free as you can get it. So I went to the trouble of having an HVAC company come in and clean the air ducts so that would be cleaner than it had been. We researched water filters so that I knew I was going to have to drink a lot of water after my transplant. They have you drink like 100 ounces a day if you can. And so we bought a Berkey filter, and not only does it clean it really well, but it tastes great. We bought air filters for our system in the house that were HEPA filters so that they would do a better job of filtering. They also talk about not having plants either in your home or definitely not in the room that the patient is in because they have bacteria on them. So we took care of that. And then we also ordered some things that we were going to need to have on hand, some of which we are now using for COVID. So gloves and masks. Because this affects your GI tract, barf bags are important to have nearby in case it affects you in that way. Depends in case it affects you the other way. Having a thermometer because you are going to have to track your temperature on a regular basis. And then a lot of the requirements for cooking your food will require things to be at a certain temperature and cooked a little longer than you may normally do it. So a meat thermometer is really helpful there. And then I also purchased a shower seat because I wasn't sure how weak I was going to feel after my stem cell and taking showers at home. I also planned, so I knew my husband would be my 24/7 caregiver, but I was also feeling that he was working full time at home. It gave him some flexibility, but we had my mother-in-law living with us and we had 2 dogs, and I felt like he was going to probably need some help along with that. So I arranged for my sister, who's in the top picture with me, and you can see me on the left. That's when I had no hair and was wearing a hat and glasses. And then my girlfriend Caroline, who's in the bottom picture, she came for a week. My sister came for 3 weeks, so I could cover that 30-day outpatient time frame. My husband really was a great moral support, and he focused on nighttime help with me and meals. And then my sister and my friend helped me with transportation daily to the clinic and just help with additional moral support, would do some cleaning, would do some grocery shopping. I think for each of you, you just have to think about what does your significant other, what can they do for you that's appropriate, and what might you need beyond that to line that up ahead of time. I think any kind of pre-planning there can just help make the process go smoother and lessen the stress on everybody. Hair loss. So this is something that's fairly emotional for all of us. You can see I've got much longer hair now that it's been 2 years, but many people that I talked to that had lost their hair, it's the first time that the world sees you as a cancer patient, and that maybe even you then see yourself as a cancer patient. It's easy to kind of ignore it before then a little bit, but I decided to celebrate it, and I had a party. So the top photo is of my hairdresser who's in the striped sweater, and then a couple of friends, and I went from long hair, much longer than I have now, to short hair. And then eventually my husband shaved my head for me just before I had my stem cell transplant. So I think if there's a way for you to take control of it a little bit, you might feel a little bit better about it. It's also good to plan ahead for a wig. And if you can shop for the wig while you have hair, it might help you to match color. It might help you to match texture. And there are a lot of organizations that can help you to get a free wig. I use the American Cancer Society, and I was able to get one that I used periodically, not all the time, but it was nice to have. The things that I used the most were little cotton slouch caps, especially at night because my head would be really cold at night. So I would wear one to bed. Scarves and hats, anything like that to help protect you and also make you feel a little bit better as you go out in public. So this picture is of me having my stem cells collected. So that's the apheresis machine that collects them. So a couple of the processes that I went through prior to the transplant was that they have to put a catheter in, and it's hard to see in the photo, but I had a trifusion port. So there were 3 dongles that came down, and they used 2 for the collection process, one to take the blood out and then to collect the stem cells, and one to put it back in. I also had a dose of Cytoxin, which is another chemo drug, and I had that 2 weeks prior to the stem cell transplant. One, to help lower my cancer level because I was still at 40%. So I was well above the normal range that they'd want you to be at. And then also to help mobilize my stem cells. And they tell you that you're going to lose your hair about 2 weeks after your high dose chemo. And it's about exact. That's when it really started to fall out. So that's when I had my husband shave it. They also give you Neupogen shots. And sometimes there's some other shots. I think Mozabil is one that Don's going to talk about. But they do that about 5 days before the collection, and they're trying to push the stem cells out of your bone into your bloodstream to help the collection process make it easier. They do give a couple of recommendations right before your collection, the night before and the morning of, if you can eat a more high calcium rich diet, that helps the process. They oftentimes collect enough for 3 transplants or more. It depends on the person. They were slating me for a tandem transplant, so they wanted to get at least 3. And I was able to be done in a 7-hour day, but a lot of people, it may take 2 or 3 days. It's really unique to each person. So then on the transplant, again, I tried to smile and make each day a little better. My husband had bought me this beautiful soft coat because you tend to be cold during the stem cell transplant process because you're eating popsicles or ice cubes. So this kept me warm, and he popped a shot for me the day that I had my transplant. But at Sarah Cannon, it includes 4 days of inpatient and then 30 days of outpatient. So day 1 was getting my high dose of chemo, the melphalan that we all get. Day 2 was a rest day. Day 3 was the actual stem cell transplant. And they tell you that it's kind of a non-event. It only took about 30 minutes for me. It can be 30 to 60 for others. And then day 4, I was released. And it was really based on checking my vitals and making sure that my blood work was acceptable for me to go home. So then on the 30-day outpatient process, they would tell me each day what time to be in the next morning, but it was typically first thing in the morning. And I would go in each day, they would do my blood work right away. And then once they got the results, it would let the nurses know, do I need fluids? Do I need supplements? I mean, they're often checking your magnesium and your potassium levels. They will give you pills if you can accept the pills. I really struggled with nausea and vomiting, and so I really couldn't put down the pills. So I ended up staying longer on many of my days because I had to get those supplements via IV. They're checking your neutropenic levels because within about 2 weeks of your chemo, you're going to get to your lowest point. I think I got to 0.2 or 0.5 with my white blood count. And then it starts building back up from there once your stem cells start doing their new work. It's really critical when you have that face-to-face with the nurses to talk to them about side effects, and make sure that they can give you any help that they can, because there are a lot of options typically. And also just managing your medications. You're going to be on more medications than you were before because you're going to be on an antibiotic, an antiviral, and an antifungal, along with other things maybe specific to you. And those are there to help you while your immunity is so low. They do want you to shower every day. Again, just trying to keep as clean as possible and keeping bacteria off you. And they also want you to stay mobile. And sometimes those short walks may just be walking within your house those first few weeks because you're trying to keep away from everything else. But, a little bit more each day is a good goal. And precautions, some things to bear in mind during that time while your immunity is so low. Even though it's COVID now, it wasn't COVID when I went through it, but a lot of the guidelines that you're following for COVID now, you want to continue to follow. And you may not want to allow any visitors in your home if you have an outpatient and you're home during those first few weeks when you're at your weakest. You certainly don't want anybody that has any kind of cold, not just COVID. If you have any family members that do any kind of traveling, as soon as they get home, they should stay away from you. They should go change their clothes, put their clothes in the wash, take a shower, put on fresh clothes, and then come near you. And again, if you can just keep it to the family members that are living in your home, that's going to be best. Your hospital will give you food guidelines that are best for you during that neutropenic stage. And the meat thermometer I mentioned is a good option. Gardening, my hospital told me not for 6 months because there are bacteria and viruses that are in the dirt that they just don't want you exposed to. You also want to avoid dust and mold, so you don't want to do any remodeling in your home for a period of time. And then also, even like I used to go out for a ride in the car because it was a nice way to get outside and still be safe. But you want to keep your windows closed if you go by construction sites. And if you live in Nashville, we got a lot of construction going on here. So we definitely needed to keep the windows up a lot. And then this is a really good time for you to say to your significant other, I'm sorry, I can't pick up after the pets. You get out of that duty for a while because they don't want you to be exposed to it. So managing side effects. So again, it's going to affect your entire GI tract. And I know people that have had very limited side effects and not problems at all. Unfortunately, that was not the case for me. I had a few weeks of not being able to hold anything down, not even a bite of a popsicle. Couldn't take my pills, couldn't ingest the water that I needed to. So that's why at the clinic each day, I needed to get more fluids and I needed to get more supplements via IV. And I probably should have spoken up sooner, but on day 11, I finally knew that I wasn't managing it properly at home. And I told them that I needed to be checked back into the hospital. So I went back in for 5 days so that they could administer medicine through my IV that would help get this under control. And once we did that, I was able to go home and better manage it. Still didn't have much appetite, but I could at least keep some things down. The Cytoxin did give me mouth sores, and they did prescribe magic mouthwash, and that worked great within a day or so. Diarrhea was not a major problem for me, but it is for some. So it is important to have some Depends. I know it seems funny, especially at our ages, to even be talking about that, but better be safe than sorry. And then monitoring your temperature. They will tell you that anything over 100.5, they want you to call right away. And it's just because your system is so weak that if you have some kind of infection, they want to be able to treat you quickly for that. In dealing with the mental side of things, I'm a Pollyanna and I'm always looking at the bright side of things. And okay, this is an experience to go through, right? And we're going to get through the other side of this. And I was so healthy before, and I'd never been in the hospital before, and not as an inpatient anyway. And I will tell you that I felt the sickest during this that I ever had, and it's really from the side effects of the high dose of chemo. It's not from the transplant piece itself. The nurse told me it was going to feel like a bad case of the flu. And I think mine felt more like a combination of a bad case of the stomach bug and the flu that lasted for a few weeks. So I needed some things that would, because I was feeling so weak, that would make me feel better. So my chair in the shower was wonderful. I would sit in the shower and treat it like a spa treatment and let the water run over me for a while and then get up. But I had not tried meditation before, but I did find that meditation during that month was really helpful. It just helped me to calm my mind and clear my mind and think some happier thoughts. And I also reached out to friends to talk to give me a boost and hear about something else in somebody else's life. I used Caring Bridge to share updates because family and friends care about you and they worry about you and they want to know how you're doing, but they also don't want to impose during that time. So being able to post some things there where it automatically went out to them was really helpful. And then getting so many positive responses back from them really boosted my spirits to keep me moving on with my recovery. And I also got tons of cards that was helpful. So then you finally get to your 100-day testing. We did mine just a little bit early because I had to move back to New York for the summer. And the testing includes kind of the basic tests of bone biopsy, the urine test, the skeletal survey, and the extended blood work. And luckily for me, I went from 40% cancer to 0 with a stringent complete remission and all my other tests looking normal. And the image here is of my celebration dinner, and that is actually my wig. So I did not have any hair, but putting a hat on a wig always makes it look more real. But that's it for me. Thank you very much.
Great. Thank you, Amy. And Dawn, we'll turn the time over to you now to talk about an inpatient procedure. Dawn, can you hear us? Oh,
thanks, Audrey. Yes. So my situation you'll hear was not unlike Amy's, but with a few little pieces of difference. So my situation, I'm IgG Kappa. I'm standard risk. I was a relatively benign situation. I was diagnosed with was found to have a high protein level during a regular screening annual physical, and was referred to a hematologist, and kind of went into the whole situation blind. I was diagnosed in January of 18, and my M protein at diagnosis was 2.8, and I had 80% plasma cell in the marrow, but I had no bone involvement. I had no kidney problems. It was clinically, when you looked at my blood, I was somewhat anemic, but I was in a job that kept me busy, and I never really realized that. I had 6 rounds of RVD and was transplanted in August. My approach to the transplant was one that I didn't really understand, that there were options and a lot to do. So I just kind of followed and moved along. Things seemed to make sense to me, so I went forward. After my transplant, I've been in a stringent complete remission. I actually had no M protein detected going into the transplant, so it got me down into a good place before the transplant. My light chains are stable, and I haven't had a bone marrow biopsy for over 2 years now. There's waiting to see what the future brings before they do anything else. So as I said, the transplant was really, kind of presented to me as standard of care. This is how we're going to do it. I did have a couple of places. I was going to talk to the University of Maryland, and I was going to interview at Johns Hopkins. I'm in Northern Virginia, and we're very lucky to have things, a lot of options very close to us. But I went to the University of Maryland first, and after meeting Dr. Bodros there was just a connection on a personal level. I liked his sense of humor. A lot of people don't think he has one, but it's quite dry. So we had a good connection. Some of you may have seen him at one of the last big roundtable back in early March. The clearance testing, Amy talked a little bit about, all the meetings before the transplant. We went through 2 full days that included EKG, pulmonary function. They look at, do a CT of your sinus to make sure you don't have any infections, anything going. There's blood work. Remember, I went in, they drew 21 vials of blood. You want to make sure that you're really well hydrated before you go in for the blood draws. But we also met with social workers to make sure that you've got a support structure and the ability to care for yourself and have folks there to care for you. Likewise, the finance group was great. We went through everything. I was also lucky. My insurance company at my diagnosis actually gave me a case manager to make sure that everything in my situation was being addressed. And then when I was referred to transplant, I actually got a transplant case manager. So for those that are facing this, those are things you should talk to your insurance company about. It's very, very helpful, and many of the insurance providers have those. Likewise, I was mobilized with a Cytoxan infusion that took about a 6-hour, and then Zarzio is just another version of the same drug, different manufacturer, as Neupogen, growth factor. Those were had to do three self injections every day for about 10 days. before my harvesting. The day before my harvesting, I went in and had the line placement. I had a catheter placed in my chest, and with the blood work that was done there, they wanted to give a little boost to the process and gave me an injection of Mosabil. What was interesting, they said the Mosabil, I had to wait. You had to wait like 30 or 45 minutes after the injection to watch for any allergic reactions, and they also said that it could cause some nausea. So they gave me a dose of Compazine that I could take with me, and so I had that with me. But the problem was, I didn't learn this until the next morning, is the Mosabil, yes, it can cause nausea, but the main thing is that it causes concern in the GI tract, and just as much as it can cause nausea, it can also affect the lower GI, and that's of course what it did to me in the middle of the night, and I was not expecting it, and it was somewhat painful, but we got through it. The next day, that was when I had my line placement, which went fine. And then the apheresis, they said to plan for 2 full days. You want to bring snacks and water because you can't move. They get you connected to the machine, and it has to run until it's done its thing. I was lucky. I actually produced about 18 million cells in about 4 hours. So that was enough for 4 transplants, 3 to 4 transplants, and in a very rapid time. So the Mosabil did its job. So in doing inpatient, you're in the hospital, but it's different. You want to make sure you have comfortable clothes. They want you to get up, dressed, showered, cleaned every day. They want you to get it to operate as much as normal as possible. But you're going to be in for 2 to 3 weeks. I was in for 15 days, which is about the minimum. But as such, you're going to need to replace those clothes. You're going to need laundry support. We live an hour and a half plus, depending on traffic, from the University of Maryland in Baltimore. And so my wife did come back and forth many days. Once sent my daughters with, change of laundry. But so that's something you need to plan for. And when you're in, even if you don't feel like, you've got to walk, you've got to stay active. Same thing, you're going to lose your appetite. So try to have something that you can snack on that may be, that you may find appetizing. I found when I was at the lowest point that peanut butter filled pretzels was about the only thing that made sense. That, and I also did about 3 days where all I had popsicles for breakfast and ice cream for lunch. It was just something to get calories in, and then they brought me in Ensure. One of my big tips, and Amy mentioned it, is adult diapers. I think I was at about day 3 or day 4 in the process. And the nurse practitioner who ran the ward there, we were just talking, and she made a comment about, you will lose control of your bowels and you won't realize it. And I said, oh, really? And so I had them bring me the hospital version, which were, strap-on diapers, and not a fashion statement, by the way. And as luck would have it, that night, so, and I've given this tip to several, and they have come back and thanked me immensely for the tip. You want to have books or movies, things you want to stay busy, even if you don't use them. I mean, I had my Netflix watch list all set to go, never even opened it. So And another point that has been raised by several is you're not necessarily going to have quick access or local access to a plug. So you want to make sure you have a long charger for your cord or for your phone. So, of course, one of the things we use the short-term stem cell transplant, but of course, the actual full name of our little procedure we're talking about here is high dose chemotherapy and stem cell rescue. The transplant is really to address the actual treatment. The treatment is the high dose chemo to try to kill off whatever's there, but it kills everything off. So you actually have to be rescued with the transplant. Amy mentioned trying to stay cold. You want to keep your mouth cold during the melphalan infusion to keep the capillaries in your mucous membranes constricted. This will help prevent mouth sores and other things. We've talked a little bit about side effects. You definitely want to listen to your body, and you don't want to be shy about your side effects. You want to tell the doctors and nurses if you're having any discomfort. We talk about mouth sores, but the melphalan can cause irritation throughout all of your mucous membranes, as I say, from tip to tail. I was very fortunate. I did not have any of those issues. My issue was nausea, but one of the things being inpatient with the nurses and the meds right there, they were able to stay on top of my nausea. And I'd say it took about 18 hours, but we got down to a process of loading compazine and Zofran in a progression that kept my nausea completely under control. And I think after that first 16 hours or so, I really didn't have any nausea because they were able to stay in front of those effects. Later on, you'll get another shot or a few days of Neupogen as they try to boost the stem cells to keep doing their job, and you may get some bone pain. You will develop diarrhea, and when you do, your room is probably going to be isolated until they test for C. diff. So these are little things that people don't necessarily tell you about going in, which is why we try to share this fun information. Your blood counts, watching your blood counts go down, watching your white cell, red cell, and platelets go to zero is a little bit scary. And that happens over about a 10-day period. The stem cells take about 7 days before they start figuring out what they have to do. So there's a bit of a crossover. And it takes after you go to zero, it takes a few days to come back up. You get released when you're a little bit better, not necessarily when you're all the way better. And that's where Mary will give us that long-term picture. Next up. So in my situation, I did not live close to the University of Maryland Hospital. So I had to I got a hotel just outside of Baltimore, and my wife and I stayed there. Actually, my oldest daughter stayed with me the first couple of days because my wife was taking our youngest to her freshman year in college. So that was, sometimes, life happens. So I had to, be prepared to go back to the clinic for follow-on cases. I was told, plan to do three visits the first week, 2 visits the next week, and then a couple more times. I actually ended up only going to the clinic 3 times over a 2-week period, and then they discharged me and said I could go home. So I was told I needed to be up there for 4 weeks. I got out early and I got home. But your situation, everybody is different. The big thing though is you've got to listen to your body. I tell folks naps will be your best friend. That first 2 weeks out, I napped probably an hour and a half to 2 hours or more every afternoon. A couple of tips, they'll tell you to move slowly, sit up, and stand up slowly. I had a friend of mine who'd been through a transplant for lymphoma, told me to pump your ankles about 5 times before you stand up. You also want to make sure you have a cane, because you will be unsteady and there will be times that you'll feel better or worse, but you want to try to walk with that cane to make sure that you have a little bit better support. Your temperature is going to rise and fall. Yes, that 100.5 is important for infection. I watch mine go to 100.2, 100.3 every day for a week, and that was part of the engraftment process. I did call the clinic several times. I think I may have upset them some. And so, they will tell you it takes 100 days before you're back to quote normal. I didn't believe them, but trust me, it is that thing where you just don't feel 100%. You want to listen to your body. Talk a little bit about, food safety. You want to try to keep active though as much as you can. Avoid sick people. Wear your mask when you're out. You wash your hands. This is all in that first 100 days. Said everything that everybody's going through with COVID, we've lived and continue to. And then you want to return to work with care. My docs wanted me to stay out of work for the full first 100 days. I went back to work after 6 weeks from my transplant because I had decided to retire and I needed to get back in and do my transition. And things worked out for me. But again, it's an issue of, doing what's right, doing what's smart. I believe that that's the last point. So back over here.
Thank you so much, Don. That was great, and I really appreciate you and Amy doing the inpatient and outpatient aspects. And now we're excited to hear from Mary as she talks about post-procedure recovery. This is going to be, I love the nitty-gritty that Mary shares, so we're excited.
So a lot of crossover here because it's that important. Briefly about me, I was diagnosed in 2015 at age 55. Literally the day after my 55 birthday, I landed up in the ER because I couldn't walk. And some people thought that was important. So they took an x-ray at that time and all they told me was, you might want to go see a back doctor. And I didn't, the urgency was not placed on that. So I went to go see an internist and through many begging, finally got an MRI that showed a tumor on my lower lumbar and 4 fractures and many compressions on my spine. I went to Seattle Cancer Care Alliance, known as SCCA, and that particular bone marrow biopsy showed 80% abnormal cells. My history is 2016, I started a trial. Next slide, Audrey. And in that trial, I was on RVD, and they selected half of the group to go through stem cell and half of the group would not. We didn't know who was who. So they harvested everybody at 3 months. I was harvested in 2016. And I went through a year of treatment before I had my spinal surgery, which there was a lot of conversation about that. And because of that year waiting, they could not fix any of the compression fractures, but I do have 2 rods and a lot of really cool tools in my spine. Presently, I had my stem cell in 2018. And I wasn't real keen on going in for a stem cell transplant. They had to do a lot of negotiating. Presently, after the stem cell transplant, my bone marrow now shows 1%, and my MRD shows, now MRD is minimal residual disease. That's a new topic that you might hear about, is showing positive with 5 parts per million. So this particular portion of the program is going to talk about now it's time to go home. And for me, that meant 30 days. I was away from my home because of my logistics and because of conditions I had that they wanted me in the hospital. I was in the hospital for 2 weeks, and then I was in an apartment nearby that was sponsored by the care center for another 2 weeks. And they let me go on day 29. So it was rough. And you'll hear this ad nauseum. Welcome to your new normal. And so it begins. You're released from the clinic. Now what? So at this point, day 30, they remove your Hickman or your ports or your catheters, and you know that you're released and you're ready to go. And you have this really cool haircut that's starting to look like a crew cut. And the fact is, if you started with hair before the transplant, you will get your hair back after the transplant. So there's no miracles here about hair, but it will return. And you want to remember that your hair is going to come back a little differently. It may look gray, it may look white, it may look darker. I had curls, they call them chemo curls, and they say it's like your hair's coming through a ribbon that's being pulled, and your hair gets this really kind of poodle look. And it goes away after the first haircut, so you will return. So then you have to remember that you are going through a lot of work. Your body's working really hard. Sleep is so important, and you don't have a choice, because sometimes you just take a shower and then you walk out of the shower and you fall in the bed, and 2 hours later you wake up. But recovery takes 3 to 6 months, easy. The cells in your mouth and stomach and intestines and hair and muscles are all in a regrowing state. And the first 100 years are going to feel like a year. Get help before you come home. This is critical. First, you have to be able to ask for help, and then you have to be able to accept the help. So before we got home, we had a team of friends come in to clean the house. We had the carpets cleaned professionally. We had to make sure all plants, as Amy had mentioned, were removed out of my rooms, and anything that had to do with pets or plants or dirt was all taken care of by somebody else. I was able to delegate, and that was not easy to do. So keeping your home clean is very important. And consider placing, I have a small refrigerator and microwave in a room that's adjacent to my master bedroom, because there are times even still where I just can't make it downstairs. So you have a supply of things right there at your, just right across the room there. You will be washing your hands a lot. You will be using antibacterial soap and hand sanitizer a lot. So you will have to I kept a bottle in every place around the house, at the doors, in the bathrooms, in the kitchen, and make sure people use it. When you have visitors coming to you, you want to make sure that it is safe for them to come in. COVID has set us up really well for that. We now don't have to make excuses why we're asking people to wash their hands and sanitize and wear a mask. And we don't have to make excuses why we're wearing a mask. I mean, before all this happened, I was walking around town in blue gloves and masks, and little kids would look at me and they think, I could hear them asking their parents, why is she wearing a mask? So, and I live on a small island, so people all knew. And you will go through a lot, and you have to ask your friends and family to help you get through this. But keep in mind, don't feel bad in telling people, if you're sick, don't come. If you have chickenpox, or if someone around you is exposed to chickenpox, if you've been recently diagnosed with herpes simplex, this is about the virus that causes cold sores. Shingles is a huge barrier for us, and you may even be on acyclovir or valcyclovir on a daily basis to help prevent shingles. And if anyone around you has been recently exposed to a virus or infection, or if they've taken a live virus, that happens a lot with babies and children who are taking their vaccines and immunizations. And you want to make sure that your doctor knows if you've been exposed to anything like this. And of course, if you've been exposed to COVID. And it's okay to say, don't come. And that's where you get to use FaceTime and Zoom and all those wonderful things that we just learned about and is coming into our life. So we talked about exercise, and it is so important. Even if you don't want to do it, get a coach, have someone call you, ask you, did you walk today? Did you climb the stairs today? I know every step in my house. I know how many stairs it takes to get up, and I know where I can land just in case I don't make it to the top. Just to take a break. It's so important to get out, and it's so important to start living again, because 100 days is coming. You've got to build up your strength slowly. Be careful going out during high peak hours. You want to avoid supermarkets, shopping malls, movie theaters, places where you are coming into close contact with public. You know, we now have church on Zoom, so I've gotten through that guilt of not being able to go to my church. Swimming is another question that a lot of people have, and you want to talk to your team about swimming. And what does that look like, and what does that mean? And can you go back into the pool again, or can you go back into the river or the lake or wherever you like to swim? Staying in touch with people is important because you feel isolated. And we all know what that feels like because of what we just went through with COVID and still are experiencing. But when you are going through your transplant, you're alone. It feels very lonely, and there's a mind game that you start playing with yourself. You got to be careful, because you can go down that rabbit hole, and you want to make sure that you're staying on top of things and fresh, and recognize your limitations. There are a lot of rules and recommendations that are put on us for a reason, and mostly because it helps keep us safe. Your immune system is suppressed right now. You want to work within your limitations. If you can work from home, that's great. If you can go back part-time, that's great. Some people will see that around the 3-month mark. I am on disability, so my only job, first and foremost, was getting through 100 days and surviving cancer. Brain fog is real. I enlarge that because you think you should be feeling better at this point, and I'm almost 2 years out of my stem cell transplant, and I'm still going through brain fog. I keep notepads around. I invested in a lot of sticky notes, but I can't find them all, so you lose things. You want to have things around to help trigger your memory, and you play games. I do word searches. I do puzzles, coloring, just to and keep walking. All these things will help your brain fog seem a lot less intense. And you want to start walking as soon as possible. Now, I took a lot of time with my slides on pets because my pets were important to me, as I'm sure they are to you. My pets didn't see me for 30 days. They missed me. I got cards from my pets. It was a very sad time. But more importantly, I had to remember when I got home, there were rules about my pets that they didn't quite understand. And you have to remember, animals carry disease, even our beloved pets that we take care of. And we're at risk of catching infection because we're so immune compromised. If you have a pet living in your house, remember you have to limit close physical contact with them. Don't hold the animal on your lap. Don't touch the animal's saliva or fecal matter. And like we said, it's a good time to ask for help. Be sure to protect yourselves from bites and scratches. Don't handle, this was, when I heard this next one, if you have birds, lizards, snakes, turtles, hamsters, rodents, while you're recovering, you're not permitted to handle them. And if you have an aquarium and you're the only person who can clean that aquarium, make sure you're wearing gloves. And you may want to wear your mask too, because there are fumes and things that come off of there that we don't really think about. I was told pets can visit me, but not sleep with me for the first 100 days. My dog seemed to know and was okay to lean into me again. And you can see by the photo, there she is up on the top of my head of my crew cut hair. And she was so ecstatic when she was allowed to return to my bed again. And next slide. Oh, vaccines, they're coming. Your childhood vaccines. I mourned the loss of my childhood vaccines. I worked hard all my life for my vaccines. And then about 1 year post stem cell, you are set up again to start getting revaccinated. The photo there is I walked into my treatment day, and there I was faced with 12 shots that I was going to get in addition to my FastPro, that shot in my stomach. So, and that was my first round of shots. It could take about a year to finish all of your shots. Food is so important during this time, and there's a lot of rules around food. It was almost easier to eat at home and not worry about food, how it was cooked, how cooking it. People wanted to bring me food, but I had to say no because I wasn't sure what their kitchen looked like. I wasn't sure to what temperature they were cooking things. And quite honestly, food doesn't taste the same for a while. You may have a metallic taste. Things may not taste salty enough, and you have to be careful. Don't over salt, and just trust that you're getting the right amount for that time. You got to follow the rules closely for food. Maintaining a low bacteria diet is important until your immune function is back to normal. You wait 30 days to eat raw fruits and vegetables. All your life, you're told to eat fruits and vegetables, and now you're told, wait. You got to be careful. They have to be at the right temperature. They have to be processed. It's just easier to just wait to that 100-day mark, and it will come. And you can celebrate by going out and having some food. Plants. That was the other place I mourned, was my garden. I had to get help, and that was hard. But the best part about it was when I hired that help in, I was able to go and enjoy that part of my garden again by just walking around. Gardening is forbidden for the first 100 days. And you can't even, I was told not even to deadhead my flowers, which first they throw the pets at me, then I can't eat vegetables, and now I can't deadhead my plants. So I was counting down the days. There is a topic that you need to address and understand, that there will be sexual changes in resuming sexual activity. If your platelet count is under 50,000, precautions need to be taken. And both male and female may experience low to no sexual drive. You understand that females may go through early menopause. You may have fewer menstrual cycles. You have dryness or discomfort. Men may experience lower sexual desire, erectile dysfunction or ED, and damaged blood vessels. As your hormone levels return to normal and you gain strength and endurance, your sexual desire returns to normal too. Alcohol and tobacco, well, that's, you want to say duh, but you understand that alcohol can harm your liver and recovering your bone marrow. And you're working hard, your body's working hard on your cellular recovery. Tobacco slows that cellular recovery. If you smoke, talk about cutting it out or cutting it down, but you can also ask for help in that too, and your clinic may have a smoking cessation program. Dental care is very important. That you may be advised to use a daily fluoride treatment. You're advised to delay any dental work for the first 30 to 100 days. Of course, if you have an emergency, you have an emergency. You need to talk to your transplant team and have your dentist talk to your transplant team on how to handle your emergency for your dental care. Things you want to look at and watch for: jaw tightness, toothaches, discoloration at the gum line, and receding gums. All these things are common. During your recovery time, you may notice I have eye problems or blurred vision. For the first 30 days, my vision was so compromised, I couldn't see the TV, I couldn't read. And it was all because of the chemical reaction to the chemo that was received. It did return, but during that time, I kept books on tape or music, and I was able to navigate the TV by listening. It was that blurry. I couldn't see. Glasses didn't help. But if you have to be aware that if you have vision or cloudy or blurry or foggy film, make sure you contact your eye doctor and your team. Changes in the way you see color, problems driving at night if you're still driving, glare of oncoming headlights, problems with glare during the day or double vision. All these could be signs of cataracts. And medications that you want to avoid, you'll get a list. While you're probably taking a handful of pills already, you'll be taking probably a second handful while you're in recovery mode. Do not take aspirins, medication containing aspirins, or non-steroidal anti-inflammatory drugs. So those things are important to understand that they will impact your liver. And again, it's all for your own benefit. Next stop is survival. And I have to say that even after day 101, we're still surviving and still regenerating. The one key point I think that I took away from all this is keep hand cream around. Skin changes are ongoing and constant. Finding a good hand cream and skin cream to keep your skin soft and not looking like scales on a dinosaur, that was a good investment. I'm done.
Thank you, Mary. I loved that. And Amy, Dawn, Mary, that was such a good summary. I hope that it really helped you guys. And now we can move on to the question portion. Again, we have until 12:30, so we have about 25 minutes. And now is the time to ask questions to any of these three coaches. Keep in mind that they are not medical experts, and there are questions that can only be answered by your medical team. If you do have a question, click the raise hand feature at the bottom of the screen. Again, if you are on a laptop or a desktop, you bring your mouse toward the bottom of the screen and then a white bar should appear. There should be an icon of a hand, and if you click it, our system will let us know who raised their hands and in what order. If you are on a mobile phone, tap the screen and the hand icon should appear near the bottom of your screen. If you don't feel comfortable raising your hand, you can also type your question into the chat so that we can answer you. But we will begin, and I'll stop sharing so that we can see a little bit better. All right, Barbara Travers, if you want to unmute yourself and then ask your question.
There, did I do it?
Yes, ma'am.
Hi, I'm Barbara. I am on day 41 post-transplant. And I want to thank Amy, Don, and Mary, because there were bits and pieces from each one that applied to me. I think I'm doing pretty well. I actually kept 50% of my hair.
Oh, good.
I have
Awesome.
splotches, but this is mine. And so, I'm able to do that. But, and it was really interesting. I mean, Mary was just saying that the vaccinations will start a year after. Mine are going to start 6 months post-transplant. My COVID shot is 3 months, so I can't wait for that. That's a biggie. So it just seems to me like things are different. From everybody is different, but I don't know, maybe doctors. And even the pre-collection was different for me. But, and I think it was Amy did it in one day. That was like a superstar. I did it in one day too, 10 million, and that was pretty cool. But one of the things, so I was totally outpatient until 6 days post, when I had a fever, and I went into the hospital every day post transplant, and then they were like, "You're not leaving, you're staying with us." So they admitted me, and it was right around then that I started getting bone pain. I mean, I think it was bone pain. I'm not sure, and no one talked about pain, like actual pain. I got pain in my deltoid, and this one, and then my left thigh, and now in my hips. And it's usually at night when I'm not moving around and I slow down. And my doctors are like, we don't know. One of the nurses at the hospital was like, "Yay, it's working. Those are your stem cells knitting away in your bones." And I'm like, whatever. Anyway, it was extremely painful. And I had to take oxycodone in the hospital. and afterwards, and I just didn't expect the pain from the diarrhea to the hair loss and all the millions of other side effects. No one ever spoke to me about actual pain, and it's getting better. I do a lot of yoga, and I really think that helps a lot because I'm what I'm doing. But I think it's getting better. But did anybody have any pain?
Yes.
Yeah.
So
when-
I can
Well,
start with that. Or Don,
well,
Don, go ahead.
I was going to say, go ahead, Amy.
Yeah, I had a lot of pain. I mean, I still had pain from the back surgery, but
Oh,
I
yeah.
did find that because I was lying in bed a lot during those first several weeks of recovery, that I would wake up and my thighs would hurt and my arms would hurt. And I do think that I would describe it as bone pain. It just hurt. But about 6 weeks out, I started doing yoga and Pilates every week. And I think by moving the joints, and maybe that helps with the circulation
Yes.
too, that was helpful. I also noticed on the screen that Christine Walters mentioned Claritin. And yes, the nurses did mention at my hospital that Claritin sometimes does help with that during the bone pain. And there's certain shots that that when they give them to you may cause bone pain, and oftentimes the nurses will tell you that.
Yeah. I take Claritin every day, so that may be helping. But you know,
I live in pain 24/7. One of the few, the pain didn't go away when I had my first surgery. And a lot of that is nerve damage too. But I recall I was going through nervous. The pain was incredible. And what I kind of correlated it with my life journey. It was weird because every day, after I get those wonderful G shots that I call the Hulk shots, the pain would travel from head to toe, and I can almost tell you exactly what happened at that point. Oh yeah, that's when I fell and hit my head. I remember I fell and on my spine. Oh, I remember. It was like a journey of my life pain. And it started every night at 3 p.m. and it ended probably around 11 p.m. And nothing helped the pain for that. But keeping moving, making sure I was drinking plenty of water, because there's a lot of toxins running through your body. And Claritin didn't do anything for me, but I have chronic pain, so I'm kind of the Abby normal of the group.
Don, did you have anything extra you wanted to share?
Well, it's just that if, it is very possible that during the engraftment process, because the stem cells are, doing and producing more stuff, especially if they've given you Neupogen or Zarzio, one of those growth factors, because I got that in the hospital in the second week, and I did get quite a bit of bone pain because that is just it's causing more motion. The Claritin worked amazingly well. And for those that don't know, because they don't tell you, it's one more thing that they don't tell you. But when there is this production of cells in the marrow, it pushes on the interior of the bone, which doesn't move, so it raises the pressure, and the bone produces histamine. So the Claritin is an antihistamine, and that's why it works on this type of bone pain. And it's amazing, and which, we've talked to a lot of folks, and it's like, well, how'd they figure that out?
Yeah.
But at 41 days out, you've still got a lot of stuff going on. So yeah. But as Amy said, keep moving.
Yeah, thank you, Barbara. You got this. We're so glad you're here today. Okay, we have, I don't know if it's Charlene or Charlene Borger.
Yeah, I'm here. So I don't know if you can see me.
Yes.
But okay, I can't see me, so I don't know if I'm on the screen or not.
No, it's okay.
And I'm not sure if my question's of general interest. It's more probably for Mary, who sounds like she had the back issues and the tumors in her sacral spine that I've had. So what I haven't been able to find really is the support for the, that part of my body. I'm seeing it has more of an interest in the cancer treatment. So I've got a great oncologist, but I was wondering if Mary could tell me how she pursued, or did they pursue you? Did you just get those consults handed to you? I just don't know how to get my my back, to be treated properly. I've got back brace. Don't wear it; it hurts my back. I've got, I'm getting better, but I've had a setback recently where I did a CT and found that I had continued to have compression in my back. So I had to stop, doing as much. And then now I'm back to probably where I was before that. But anyways, would you do, Mary, or should we talk about this like offline or something, just the two of us?
It's a great question. It's great.
What first thing people, when I'm addressed or asked a question about my spine or my cancers, first thing you ask, are you seeing a myeloma specialist?
Yes.
Okay. All right. And that team is big. It's huge. It's not just your doc and his nurse. It's the entire clinic. So remember that. So you want to ask, what does the clinic provide for pain management? I see a pain team, which helps navigate insurance, so that when they're prescribing those the morphine and the oxy for me, that the insurance company is not raising their eyebrow. The first thing that we got was a neurosurgeon, and that was in 2016. That they lined me up to go get testing done with a neurosurgeon that was on the team at the University of Washington. So I kept asking for, and my team, they're angels. I mean, if I have pain and they know that I live with some high pain, and if I'm complaining about it, they'll send me in for scans and tests and checking things out. And the neurosurgeon, after I was done with my surgery, said to me, anytime anything changes, call me immediately. So what I would suggest is keep pushing your team to go get that MRI done with a neurosurgeon, not just with your myeloma specialist, but you want someone. And Amy also had a debilitating back issue too.
Yeah.
Landed with a back issue, and it was clear that there was a back issue. Mine was through discovery. So, and probably about a good 6 months of keeping pushing and prodding. Does that help at all?
Yeah, it sounds like, again, you went through. What I'm going to have to do is just pursue it on my own a little bit. There's a great team. There's a pain management team. There's a dietitian. There's all these people, but I don't see a neurosurgeon on the team. So that's probably a good idea.
You're your own best advocate. And also the social worker in your clinic can help you navigate, as well as palliative care. I think a lot of people forget that palliative care is there to help you navigate with your team. It's not just about end of life. It's about care and ongoing comfort and making sure that all of your medications and needs are being addressed, because your doctors are busy. So, keep pushing.
Okay. Yeah. And I did have a vertebroplasty for all four actually of my vertebrae that were compression fractures. And it was successful to some degree. Actually, it was the best that they'd ever seen done in the facility where I'm at. But even so, it continues, right? I just don't know how soon I'll be able to say my bones are, retaining enough calcium to stay strong, or however that works. Okay. Thank you.
Wonderful.
Can I add one thing in there, Audrey?
Of course, Amy.
So I had kyphoplasty done on the 3 vertebrae, and I was told by my orthopedic surgeon, who was recommended by my multiple myeloma specialist. That's how I got to him. He was not part of my normal group, but he was a recommendation from my specialist. But I was told by him that because my vertebrae, it was like 2, and then a couple vertebrae were fine, and then another one, that the other ones in between could be could have issues in the future. So far in 2 years, there hasn't been. But I did have a DEXA scan done right at my diagnosis, which told the doctors and myself that I was osteoporosis and what my numbers were for my hips and my back or my lower spine. And then I just had another DEXA scan done 2 years later, and my numbers improved dramatically, and I went to osteopenia instead of osteoporosis. So that's the only thing, a test that I've been able to see that really said that your bones were stronger. And I think it was a combination of things, but I get Xgeva shots once a month for bone strengthening. So I think the combination of that and exercise and vitamin D and calcium supplements all are working really well together. So there can be an improvement in the strength of your bones post stem cell transplant.
Wonderful. Thank you, Amy. I know Elise was on here earlier and wanted to ask a question. Elise, are you still on? Elise Dorian? Okay, maybe not. If anybody else has a question, you can either enter it into the chat. We're answering a couple questions. Oh, there you are. Okay.
Hi.
Hi.
Hi, everybody. Actually, just a little quick note on the last, I forget her name, she was just talking, but I actually just went through the exact same thing. I have a spinal plasmacytoma, and I'm going through treatment first before they address it in any sort of reconstructive way. But I said the same thing to my doctor the other day. I said, like, the treatment and care I'm getting is great. I said, but it feels like I'm just being treated for my blood. I said, what about my back? Like, my back is obviously what brought me to you to begin with. And I felt like it wasn't really being addressed. So what I did is I actually brought it up with my family doctor last week, and he said that he was going to make sure that he spoke with I had an orthopedic oncologist at first diagnosis. So we're gonna go back to him and kind of discuss it, just for next steps. So yeah, I went through my family doctor to get my back addressed because I felt the same way as you. So anyways, I just wanted to pass that along as I was listening to you. But I guess my question is regarding the transplant. I have 2 kids. I have 2 little kids. They're 7 and 1.5. And I guess my question is how long do I need to keep them out of school for? How long do I got to keep them out of daycare for? I don't know if anybody can answer that question for me, but it's definitely something that's very important, and trying to figure out how I'm going to plan with all that.
Yeah, that's an excellent question.
Mm-hmm.
Does anybody want to try to answer that, or even in the chat if you have experience and want to share?
Having kids in a home is part of living, and you need to keep yourself and teaching them, like I said, COVID is a great thing. My guess is they're wearing masks, and they probably, as soon as they walk the house, know to wash their hands. Following rules of making sure that you walk in the house, you wash your hands, you take off your shoes in the garage. If you have a tissue, you wash your hands after using tissue. It's about training, about getting your kids on board. You don't want to live in a bubble, and your kids are your best ambassadors for a lot of things, and germs. But by teaching your kids to get through that first 100 days, it's just 100 days. And starting now before you go in your transplant. So start the practice now.
Okay.
And also inform your school that you're going through this. So they can inform you up early. We're having a flu outbreak. Somebody in your kid's class has lice. Somebody in your kid's class has chickenpox. Names. Your information. School should be able to give you a hand in that.
Okay, thank you.
You know, just to add to that, the other thing is you're, as it was explained to me, is, you know, when you go home, your home is your bubble. You know, yes, you have things cleaned up, you've got that ready, but you know, it's, you know, you've got to start building your immunities back, and you do that within your home. And as Mary said, you know, and you know, your kids are your home. There are certain precautions, you know, food, you know, fresh plants, the litter box. You know, those are the things. But everything else is your space. You go outside, you put a mask on for that 100 days, and you're, you know, and you keep distant from folks. But when you come home, that's your place. In fact, you know, when I went back to work, what I you know, I discussed it with the doctors. I was told that my office was my bubble. So when I would go to a meeting, I'd wear a mask if I was somewhere. But when I came back in and walked into my office, my mask came off, and I was able to function, you know, that way, you know, phone, computer, whatever else. So, you know, again, it's just, you know, it's you can't stop living, but you got to just be careful and aware. But you got to kind of think of it, you know, what is your bubble?
Yeah, that makes sense.
And at least you
Thank you.
make a game of it too. Put a big chart. Once you train everybody on how to wash their hands, take off their, you know, be diligent about that, then you have a big chart on the refrigerator of mom's 100 days. And then celebrate. What are you going to do on day 101? And it's getting through, just getting through. And, you know,
That's a great idea.
I had experience when my boys were very, very young. I was caregiving for my then my husband who passed away, but we had a bubble in the house, and they knew you can't have friends over right now. You can't, and it's hard, but they can go visit friends if your parents are honest and be clear that, you know, we got to not come if you're sneezing. So
yeah,
get help. Get help.
I will. Thank you so much, everybody.
Best wishes to you.
Great.
Thank
Thank you. We just have one last question, and then I'll do our outro announcements. But somebody asked in the chat, so if you guys want to go to the chat and give some ideas there, they were wondering if there's any websites that you use or any like services that you use in order to get the food delivered, in order to get maybe somebody to come clean the house, a nurse for care. I know that there's a lot of people, well, not too many, but there are people that don't have that family, that don't have those friends that they can really trust to give the care that they need. And so, like Mary was talking about earlier, there are people on your team that you can contact who will have references for these kind of things as well. You know, who can, you know, they'll have social workers who can reach out to different agencies. They'll have even, you know, different people within the office that have their recommendations as well. So make sure to use your team, and as we kind of mentioned earlier, be your own best advocate. I think it's a great question. So if anybody has any suggestions there, but also use your team, use your medical team, your training physician and care team and social worker to try to get those recommendations if you feel that maybe you're in a spot where you don't have that caregiver, you don't have that team that you need at home.
I would agree. I think the care team, especially the social workers, should be able to direct you and help you there. In addition, check with your insurance company, because again, you know, for a serious illness, your insurance company very likely will have a case manager that they can have you work with, and they can help you navigate. And something that they don't often tell you is, with a lot of these serious illnesses, there are additional benefits they can provide under your insurance program that you may not be aware of in just reading the brochure, and the case managers can help you with that. And certainly in-home care for this kind of stuff can be part of that, depending on what your insurance is.
Awesome, thank you.
I think part of that question, I saw somebody was asking about home food deliveries or home the programs where they deliver food. I was hesitant with that because, again, I didn't know who was handling the food and how they handle the food, and I just felt and it's expensive, and chances are you're not going to eat most of the food that's coming to you because you're just either not hungry or it doesn't look good, or so save your money and on day 101 go out to eat.
Thanks, Mary. Really fast before we go, they just wanted to know, Dawn, if you could explain one more time how the Claritin works with the bones, and then with that we'll end. Oh, you're muted.
There it is. Yeah, I was just typing a response, but it'll be quicker here. With the proliferation of the new cells in a fixed volume, you figure the marrow space in the bone is a fixed volume. Sorry, I'm an engineer, so I think on these things. And so with the additional cells, it causes the pressure to raise. Think about like trying to push more water through a hose. The pressure raises in there. The lining of the bones cause the release of histamine, the body's response to irritation. Yeah, that's why we get seasonal allergies and the like, because the histamines that get released, and we then the body reacts to that. The Claritin is an antihistamine, so it suppresses the production of that histamine, and therefore you don't get that pain caused by the inflammation of the histamine release.
Great, thank you. I appreciate that. Okay, so we're gonna finish with just a couple slides. I really appreciate all of you, your participation in the question and answers, and Dawn, Amy, and Mary. I'm just so thankful to you for your hard work. I know how many hours you put in. In fact, I probably don't know how many hours you put into this. So I really do appreciate and I'm grateful for your time here. So our next stem cell transplant chapter meeting will be on May 6th, 2021 at 1 p.m. Eastern Daylight Time. I usually tell you what the future topic is going to be, but what I put here instead was a link to a survey that we're going to be sending out along with the recording, along with the slides that were shared today. We're going to be sending you a survey. And I ask that you please, please, please help us by filling out the survey. It only takes 2 minutes. And one of the most important parts is we're going to have a list of potential topics for this chapter, and you can tell us what you're interested in. We love this chapter. We love how many people are here and engaged, but we also want to create topics that are interesting to you. So please watch out for that email. It's going to come from, I just lost my train of thought. It will probably come from me, audrey@helptree.org. And then you'll be able to get that email and help us discover what we should talk about in May. We also have other upcoming events in the Myeloma Crowd Community Program that you might be interested in. Friday, April 2nd, which is tomorrow at 7 p.m. Eastern, is the launch of our relapsed refractory myeloma patients chapter. I know this is late on a Friday night, but if you want to join us, it's going to be amazing. We're going to be talking about the new drug that's just been FDA approved, melflufen. Dr. Agni Painter from Rush University is coming to speak to us. Even if you can't make it at this time, if you sign up, you'll be able to get the recording, just as all of our meetings offer that. On Tuesday, April 6th at 1 p.m. Eastern is our Myeloma Financial Coach chapter. We're going to be talking about maneuvering the work environment when you have cancer. So Dawn touched on that a little bit, but what happens if you have a stem cell transplant? What happens when you need to go back to work? When is it time to retire? Diana Valentine, who is our myeloma financial coach, is going to be talking about what are your rights and then also what are your options. On Wednesday, April 7th at 4 p.m. Eastern, I mentioned this in the chat, but we're going to be launching our immunotherapy treatment chapter. And Dr. Mike Thompson, who's a multiple myeloma specialist, is going to be sharing about vaccinations, COVID-19, and myeloma, as well as different infections and antibodies that happen within the myeloma patient's body. It's going to be super exciting. And then that same day at 7 p.m. Eastern is our Fitness for Myeloma chapter. We have multiple myeloma specialists, Dr. Jens Hillengas, as well as his wife, Michaela. They're going to be coming. She's a personal trainer. He's a multiple myeloma specialist. They're going to be coming to speak to us about the benefits of fitness. They've done studies that show the benefits of fitness for myeloma patient studies, and then they're also going to be, myeloma patients, and they're also going to be sharing practical tips and practical exercises for keeping fit at home. And the link to register for any of those events is located at the bottom of this slide. It's also going to be sent out to you in that email. Another special thanks to our community event sponsors, Bristol Myers Squibb, Amgen Oncology, Karyopharm Therapeutics, AbbVie, Adaptive Biotechnologies, Genentech Oncopeptides, and Takeda Oncologies. And another huge thank you to all of you who participated today, who came, took the time, and to Amy, Dawn, and Mary, thank you, thank you, thank you. This was amazing. I couldn't have asked for a better presentation, so thank you so much. And we hope that you guys have a great rest of your day. Thank you for participating in the Myeloma Craft community. Great to see you, and great to see new faces as well. Thank you for coming.